My name is Dr. Zulia Frost. I'm a clinical director and a co-founder of Recharge Health. Today, I would like to present you the FlexBeam, the first targeted and wearable red light therapy device that can enhance your practice by optimizing players' recovery, performance, and accelerate injury healing. But first, let's understand the concept behind it. FlexBeam is a device that emits non-coherent red and near-infrared light via LEDs. In scientific papers, this phototherapy is researched as photobiomodulation, where low-intensity light produces cellular stimulation. It is also known as near-infrared light therapy or red light therapy or LED therapy. So, red light therapy is an umbrella term that is used specific to red and near-infrared radiation. Red light therapy devices typically use either laser or LED diodes, generating light in the same wavelengths as light that is coming from the sun, in the form of electromagnetic radiation. Visible light takes a tiny portion of the spectrum, and red, together with infrared light, takes more than 50% of solar radiation. Now, let's look at how the energy generation process is happening. Energy generation in the cells happens through the cellular respiration via glycolysis, citric acid cycle, and oxidative phosphorylation, resulting in production of energy-rich molecules like ATP and NADH. We make 10 billion ATP molecules a day to generate remarkable 1200 watts. So, red light therapy is visible to the human eye and absorbs at the skin level. Infrared is invisible and can penetrate deep, bypassing subcutaneous tissues. It is typically felt as warmth, and different cells absorb light in different wavelengths. For example, hemoglobin highest absorption level is in blue and green light spectrum, where leukocytes in red. Before we move further, we need to understand the concept of the optical window. Light absorption in mitochondria can only happen in narrow optical window between 600 to 1100 nanometers. Basically, optical window means the best photonic absorption that can activate mitochondria. And the best absorption in the red spectrum is 635 to 700 nanometers, and in the near-infrared is 760 to 1100 nanometers. There is another one, the cytochrome C oxidase. In oxidized form is a light-absorbing chromophore, which absorbs light in the range between 570 to 850 nanometers. In comparison, FlexBeam device operates within the range of 625 to 635 nanometers in red and 810 to 830 in the near-infrared spectrum. See the diagram below. So, looking at the diagram on the right side, you can see that water absorbs photonic energy in much longer wavelengths, medium to far infrared spectrum, which means the tissues become hotter. This effect is used in infrared saunas. However, thermal stimulation can increase inflammation. Red light therapy does not employ thermal effect, but rather photostimulating effect and have anti-inflammatory effect. To sum up, when light both from artificial sources or the sun is shone onto the skin, it is absorbed within the skin in red spectrum, and in near-infrared spectrum it continues penetration of the tissues below the skin. All irradiated cells will be absorbing light by cytochrome C oxidase in mitochondria, and this event will cause increase in ATP production, short bursts of reactive oxygen species that activate cellular protective mechanism and result in cellular proliferation. And lastly, photon dissociate or knock inhibitory nitric oxide out of the enzyme, and this results in vasodilation, oxygenation, and immunomodulation. As defined by one of the main researchers, Honida Anders, in summary, red light therapy have beneficial therapeutic effects such as alleviation of pain, reduction of inflammation, immunomodulation, promotion of wound healing and tissue regeneration. It affects positively angiogenesis, better collagen production, repair of the muscles, bone, cartilage, nerves. It also reduces inflammation and improving the immune function. FlexBeam can affect injury healing positively and can be used at every stage of healing. The injury starts healing with inflammation. All of you know this. But this inflammation is hugely energy demanding. So red light therapy enhances local circulation via nitric oxide mechanisms, electron transport, stimulation of mitochondrial membrane potential, and the stimulation of mitochondrial respiration and ATP production. It also stimulates active angiogenesis and contributes to faster healing. The second stage is repair or proliferation of the cells. During this stage, there is an integration of the damaged tissue and scar formation. So red light therapy activates stem precursor cells, satellite cells, and enables cellular proliferation, increasing collagen production and decreasing collagen degradation, and proliferation of the fibroblast. So there is also faster conversion from collagen 3 to collagen 1. And during remodeling stage, which involves fibroblast, myoblast, osteoblast to fuse damaged tissue and make this new functional tissue, contract and reorganize scars. It is also known that red light therapy remodels scar tissue faster. It also remodels and regenerates nerve cells as well. So both diagrams represent faster healing with FlexBeam and less pain and less inflammation. We need to address the difference between lasers and LEDs. Although both produce photobiomodulation, they have different safety class. LEDs are inherently safe. Low-level laser therapy had much longer history and accumulated decades of research. However, in recent years, LEDs science is exponentially grows. So I'm going to give you a quote from the Abru Chavez at the 2014s. LEDs and laser promote similar biological effects that are dependent on irradiation parameters, mainly wavelengths and dose. And the second quote is by De Freitas and Michael Hamblin in 2018. For several decades, it was believed that the coherent light was necessary. But as of today, non-coherent light sources such as LEDs have proved to be just efficient as laser in promoting photobiomodulation. So you could see here a couple of diagrams on your right. In the first diagram, you could see it represents the LEDs power distributed over the area, over the range, and below there's very specific monochromatic collimated laser beam which is distributed all the power into one dot, and that is of course bringing lots of energy. But we discuss a little bit more this concept later. When I looked through the available research, you could see my findings in Google Scholar or PubMed. I found that there is an absolute exponential growth in the available research articles. So here I put together some key research papers concerning sports performance optimization and some studies that research most important biomarkers. So overall, in my review, there was research papers found lots of parameters that increased or improved, and among them there are number of repetition until exhaustion, time until exhaustion, peak force, peak power performance, maximum voluntary contractions, 1 repetition maximum test, electrical muscle activity test, VO2 kinetics. Very important. So on the other hand, I looked also through the papers to see what happens when you use photobiomodulation or red light therapy in terms of what's the impact on biochemical markers. And they overall, they were also reduced, like biomarker for muscular fatigue, lactate dehydrogenase activity, and blood lactate level was reduced. C-reactive protein, of course, biomarker for inflammation, also was reduced. And CK or creatine kinase, so basically the biomarker for muscular damage, reduced. So look at these links, which they displayed in red, and you can open corresponding papers. They are really current and very interesting. Here I would like specifically to explain what is special about FlexBeam. The most important difference of FlexBeam and other red light therapy devices on the market, and it's power. The power is fundamentally important. So these LEDs in FlexBeam, they create high power density, or milliwatt per centimeter square. And this is causes high power density or high power irradiation. So compared to lasers, you see, for LED devices, LED-driven devices, you need this power, because lasers, remember, they've got coherent lights and they can enable deeper penetration through coherency, but the LEDs are non-coherent. And if they're weak, the stimulation will dissipate within the first sort of centimeter level of the skin. So power is absolutely fundamentally crucial if you want to deliver stimulation, have therapeutic effect rather than aesthetic effect. So you really need that power. So this potent dose guarantees deep penetration and complete safety of powerful stimulation without danger of burns. Because it's, remember, it's photostimulating effect, it's not thermal effect. Also, because it's used directly on the skin and over the injury, it reaches target tissue with minimum loss of energy. So all energy is delivered to the target tissue. Plus, when you bend the FlexBeam around the joint, it delivers light from 3 modules, 3-dimensionally, again to the target tissue. It has also really sophisticated sweeping waveform frequency profile and also modulated power profile, which gives also complements to different to achieving penetration depth. It is safe when compared to lasers. It is very easy to use. You just wrap it around any curves of the body or on the joint. You can even use it whilst you perform an exercise. It's portable. It can be taken anywhere and anytime. And you know, when it's not plugged to the walls, so there is a very minimal EMF radiation. And finally, it's affordable compared to other modalities. So let's look now at the available treatment programs. There are 3 programs which designed by the level of penetration. So program 1 will be used for any skin issues because it's primarily red light. So it uses 625 to 635 nanometers. Program 2 you can use for like Achilles tendon or you know, very superficial parts of the body, like muscle tissues which are just underneath the surface, subcutaneous, like small joints. And it has both 625 to 635 nanometers and 810 to 830 nanometers in the infrared. So also this is really interesting program because it employs pulsed light stimulation. And lastly, we have program 3, which majority of physiotherapists use the most, The program 3 will give you very deep penetration to reach deep joints, like for example hip joints, like sciatic syndrome, or other like very muscular parts of the body. So it uses primarily continuous near-infrared light, 810 to 830 nanometers. Now, very important, we need to understand how to use FlexBeam, how often to use the FlexBeam. So you could see the diagram at the center. This is diagram representing biphasic dose response. So what does it mean? FlexBeam is very safe, and in case of overtreated, you won't get any ill effect. The worst can happen, you just won't get the results, because that biphasic dose response known in PBM. So basically, when it's too much, too long stimulation, the effects from the treatment start diminishing. And that's why it's important to introduce occasional breaks in your treatment protocols. In clinical settings, normally you would be using 3-4 placement of the FlexBeam in combination with any other modalities you may use for the athletes. Yes, so in acute conditions you can use it frequently until injury resolves, but for chronic conditions it typically will be 3-4 weeks before you start getting results, but you can use it like on a weekly basis. So if the symptoms continue to persist, then you can resume again and do another course of treatments. Also, you have the ability to rent or give your player the device, the FlexBeam, and then you can be used by an athlete at home. And so in case of acute injury, it's important to stimulate short, like 2-3 placements or 2-3 cycles, but directly over the area. And if the player has a chronic injury, then of course you need to add stimulation of the muscles, of the spine, because there will be some shift in the body mechanics and you need to cover those areas. And also you can see, I also recommend you to use 2 devices at once, because then it will be all very effective and very fast treatment. So with 1 placement in 1 session, you can do 1 to 4 placements. With 2 FlexBeams, you could do 4 to 6 placement. And further, I will explain to you use for optimal fitness, so that will be important to know how to use it then. Technical spec for FlexBeam is presented to your left, where it is specified that FlexBeam has 3 modules. In each module, there are 2 near-infrared and 1 red LED, with the maximum output power of 100 mW per centimeter square in near-infrared and 50 mW per centimeter square in red, with maximum fluence of 60 joules per centimeter square. There are some cautions. Do not stare at the LEDs. FlexBeam has very powerful invisible near-infrared LEDs. It is not designed to use on the eyes or head. Must use goggles if light is escaping during the treatment. Do not put over tattoo. Black ink absorbs radiation at the surface of the skin and can cause localized heat reaction. FlexBeam should not be used over clothing. Clothes absorb light and treatment can be unsuccessful, but it may be used over the bandage wounds. In this case, you can put directly on it, or if the wound is open, you can arch just over the wound. Do not cover or obstruct the air vents of the device, because it will hit the device to overheat and go to automatic shutdown. This table gives you a visual comparison to other modalities frequently used for injury management. Laser is very comparable with FlexBeam in effects and results. However, it is not designed to irradiate a big area. and often ergonomically difficult to tie around joints or other parts of the body. Percussion therapy may increase your blood flow and therefore relieve pain, but it will be ineffective in case of inflammation or scar tissue remodeling. It can cover the area but will not give you the improvement in cellular energy, systemic effect, and it's not wearable. Ice packs are good to reduce inflammation and reduce pain, but it cannot give you a better circulation in the area of damage and cannot boost cellular energy, remodel scar tissue, or create systemic effects, and it's not wearable. Heat packs do the opposite. They increase local circulation and relieve pain this way, but it still does not have impact on inflammation, scar tissue, systemic effects, and not user-friendly. Infrared saunas are the latest addition to the recovery tools, effective in improving circulation and energy production in the cells, but due to thermal effect would be contraindicated in inflammatory conditions, and they are not something you can wear on the body. Besides, they are energy consuming and therefore quite expensive to run. Here is just an example of some competitive products on the market which make very similar claims to FlexBeam. However, you can see the results from recent testing. They are significantly behind in power density, which is crucial to surpass cosmetic effects from red light therapy. Of course, you need infrared lights, and of course, you need the power. And none of them can come close to FlexBeam performance. Canyon generates 0.9 watts in one cycle, LumaFlex only 1.2 watts, and FlexBeam generates 6.3 watts when in program 3. Now let's look at some practical tips in using FlexBeam for typical baseball injuries and post-surgical recovery. We can look at depth at specific injury management in our upcoming webinars. Here, using the link, you can access 20 plus protocols for common condition support with FlexBeam. When use FlexBeam, follow these 3 simple principles for placement of FlexBeam where you are dealing with an injury. Principle 1, place it where it hurts. Principle number 2, to the corresponding part of the spine. For example, injuries somewhere within legs, use it also on the sacrum. If the injury is somewhere within the arms, use it also on the upper back and neck. And principle number 3, place FlexBeam over the adjacent muscles. Let's look at the example, rotator cuff injury management. First session, you can use protocol A, where you need to irradiate the shoulder and all the muscles around. In the next session, use the protocol B. It includes the neck. You know they are linked in case of rotator cuff injury, and often it results from subluxation of C4, C5 and consequent compression on the corresponding nerves. So targeting and relaxing the muscles of the neck will help to reduce that compression. The follow-up session, return back to the protocol A for the shoulder and affected muscles, and so on. Programs and cycles are indicated below, plus the frequencies of use. At the bottom, I'm quoting a scientific research on tendinopathies as an example to what outcomes you can expect. Another example is the knee injury. On the first session, you can use protocol A, focusing on the irradiation of the knee. I often use both front and back of the knee together, and then adjacent muscles, as well as sacrum, because you know they both have impact on each other from mechanical point of view. The next session is to work around the muscles, and the follow-up session return back to protocol A, and so on. Programs and cycles are marked accordingly, plus the frequency of use. And again, at the bottom, I am listing the science paper on osteoarthritis management, which also give you some idea what to expect and what kind of typical outcome from using red light therapy. Here, some example for how FlexBeam should be used in case of the injury to the skin and soft tissue. I also quote in a couple of papers for you to look at, which state the impact and effect from red light therapy. FlexBeam should be used as soon as injury occurs. You should place FlexBeam directly over the skin or just above the surface of the skin. You can arch FlexBeam. Use the program 1 because you're targeting the surface of the skin, yes? But if the injury is deeper, you can use program 2. And also you can use program 2 if the wound already older, like a week or more. If there is a combined trauma, alternate program 1 and program 2. So use it approximately 2 to 3 times a day until the contusion or abrasions or wound is healed. In case of the surgery, FlexBeam should be used as soon as the patient is back to the ward. Local direct placement over the surgical wound will help to expedite the healing. If the wound is open, hold it over without touching to avoid contamination. If the post-surgical wound is covered, use it over the bandage or even over the cast. You can use program 3 for that. It gives you deeper penetration, remember. In addition, you can stimulate a nearby supply blood vessel. Use program 2 or program 1 when directly over the wound. One cycle locally, 2-3 times a day during the first week. Then make 1 or 2 days off and then continue using daily 1-day applications and making occasional breaks. Red light therapy can be combined with platelet-rich plasma injections, PRP, for the best results in order to promote cellular regeneration, growth factor activation, platelet activation, and fibroblast proliferation. There are 3 studies that I quote which support the use of both methods. FlexBeam can be used to deliver near-infrared light irradiation and should be used in the following way. Direct placement over the treated area or just above the surface of the skin. Use program 2 and program 1, 1 or 2 cycles locally 2 times a day for the first week, followed by a short break and daily applications until a desired result is achieved. Now, I would like to introduce the performance optimization protocols for athletes. You can start preconditioning 24 hours before the important event, then 1 hour before the game, and lastly, after the game to reduce the muscular fatigue. If you prepare a player to the game, it is good to start using FlexBeam 24 hours before. Using it over the spine energizes the core of the body, and use over the abdomen area helps to initiate parasympathetic relaxation, which will give a better focus. In addition, using it over the heart may energize mitochondria of the heart cells, altogether giving a positive recharge to a player before the event. Approximately an hour before the game, FlexBeam should be applied to the major muscles that will be engaged the most. Here would be a good idea to use both devices on symmetrical parts of the muscles. You can use them whilst the player performs physical warm-up exercises too. This was my brief introduction to FlexBeam. I would like to share with our own case studies and results in the next webinar, as well as share with various specific protocols. Please reach out to me if you have any questions. Here's my email, zulia@recharge.health. I really look forward for you to discover how effective, safe, and convenient FlexBeam really is. I'm now introducing you to my colleague, Andres.
Hi, I'm Andres, Head of Business Development at Recharge Health, and I would like to bring to your attention the membership benefits you get from PBPTS partnership with Recharge Health. During the month of May, retail price will be $50 off from $549 to $499 plus shipping and taxes, or $1,098 for 2 units. However, by being a member of PBTS, you can order one FlexBeam and still get $80 off on top of the $50 off. That will make one unit $419 for shipping and taxes. You will save $130 on one unit, or by ordering two units, you can get an additional $100 off on top per order, which will make each unit $409 or $818 for two units plus shipping and taxes. That will be a whooping $280 in savings by ordering two flex beams during the month of May alone. So if you are interested in this order, please go ahead and click the link, or you can enter the code PPPTS80 at checkout. This is a limited time order for the month of May only. If you have any further questions or you need any additional sales related information, please shoot me an email at andresrecharge.com.